you have to understand what's chemically imbalanced in your body and try to balance that out. And of
Mhm.
course, on top of that, you have to have the behavior changes and the empowerment and all that stuff, right?
Right.
I think the most successful clinics who do this and most successful practitioners who do this, have a combination of both.
Hello and welcome to the Wellness Plus podcast. I'm your host, Corrina Rachel, and I'm joined today by Dr. Michna Dumitrescu. He has a background in mainstream medicine, working with health of the spine and a lot of different regenerative therapies. In this session, we're going to be discussing how he kind of stumbled on functional medicine and why he decided to integrate that into his practice. Thank you so much for joining me today.
You're welcome. Thanks for having me.
Definitely. So, if you can begin by just letting us know how you initially became interested in medicine.
Well, medicine was in my life from the get go, I guess, because my father was an infectious disease specialist, and growing up in Romania, my mother was a biologist. She was doing ultrasound diagnosis, so I basically grew up around hospitals
Mm-hmm.
and physicians and medical people. So I guess it was the obvious choice when I looked into graduate school after high school in Romania. Medicine was pretty much what I was maybe groomed to do, or
Mm-hmm.
maybe it was it was just very very natural for me to go into medicine. It wasn't until I actually started, studying it and getting into the things that I'm doing now, that I probably understood and appreciated a lot of more facets of it than when
Mm.
I was exposed to it in my childhood. But definitely, it's been a gradual approach to it. But let's say that it was in my life from the get go.
Right. And so you kind of have I guess, special interest in the spine, it seems. Can you talk a little bit more about how that maybe, such a wide range of medicine, kind of how you ended up interested in the spine?
Well, absolutely. So after finishing medical school, obviously, you go and do a residency, which is you choose a specialty, and the specialty I chose is called physical medicine and rehabilitation. Now, or PMNR. Now, PMNR is a very wide specialty because it encompasses things from traumatic brain injury rehabilitation, spinal cord injury rehabilitation, electrical diagnostics, rehabilitation after, you know, things like hip replacement surgeries,
Hmm.
knee replacement surgeries. And then it also encompasses things related to the spine, right? So it has a pain medicine or pain management branch or subspecialty. And the people who choose to do this subspecialty, which is pain medicine, are basically focused on disorders of the spine. Now, there
Right.
are some, what we call peripheral musculoskeletal problems, let's say shoulders, knees, elbows, things like that, that we tackle. But when you study pain medicine, spine is the number one thing that you study, because a lot of the pain, or most of the pain, generates and gets back to your central nervous system, which is your brain and your spine. So spine is what you study when you do pain medicine, and this
Hmm.
is what I studied. During after my residency in PMNR, I chose to do a fellowship, and my fellowship, which is an additional training or subspecialty training, and the fellowship was in spine medicine or interventional spine medicine. So, the beauty of it is that you are able to diagnose and treat, most of the time non-surgically, right, conditions of the spine, whether it's an injury, somebody, an athlete injuring themselves, or maybe a degenerative condition, somebody who is maybe a little older and maybe a little creakier and starts having back pain and
Mhm.
knee pain and so on and so forth.
Right.
So my interest in spine began during my residency in PMNR, and then I continued it with a fellowship. And then when I got out and started practicing on my own, that's when I started practicing, spine and pain
Right.
medicine.
And so, what is kind of the, I guess, turn of events that ended up bringing you to become interested in functional medicine or integrating that into your practice?
Well, initially, when you first get out of fellowship, you're basically bright-eyed and bushy-tailed, and you want to do the best you can do, and you think that you can make everybody better by giving them a shot in the spine, or or an
Mm,
epidural, or doing some sort of a spinal procedure. And well, if you keep asking yourself if what you do actually works or not. So if you're self-critical in what you do, you're going to probably find that you're not as successful as you think you are, or as you
mm,
would have liked to be when you first started. So a rigorous analysis or self-analysis and audit of your own practice usually yields a percentage of people that are not doing better with
right.
what you do, right? So I asked myself, well, why are these people not doing better? Why are similar people coming with similar problems? Some of them are doing really well with what I do in
Hmm.
my classical training. Some of them are don't, but some of them are not doing really well,
Right.
or not doing well at all.
So either their body doesn't want to heal or recover from whatever the intervention was, or maybe they have like a negative response to it.
Exactly. So why is that, right? Well, in classical sort of PMNR slash pain medicine training, you are taught to see your patients as a collection of nerves that can be blocked, or collection of joints that can be treated. So it's always, let's find the culprit, let's find the discrete anatomical entity that we
Mm,
can do something to in order for you not to hurt anymore, right?
right.
So that's sort of the thinking behind it. Well, it took, again, some self-criticism and self-analysis for me to understand that our bodies are not just that, right?
Right.
So your ability to heal from an injury, or your ability to get better after any sort of degenerative condition takes over, um, uh, is not just a deficiency of cortisone, right? Or
Hmm.
a deficiency of spine or surgery, right? Your ability to heal rests on your whole body's health, right?
Right.
So I decided, when I understood that, I decided to zoom out a little bit,
Hmm.
So you're all
Hmm.
zoomed in, right? And in
Right.
classical training, you have to zoom in on the discrete, really anatomical entity, right? Well, I learned to zoom out a little bit and start considering people as whole organisms, right?
Mm,
And the way to do that, it was a series of I'm sure serendipitous meetings and events that happened in my life in a very short span of time, that allowed me to or got me introduced to this concept of functional medicine. Now, obviously, this is an overused concept these days, because there's everything is functional these days. But when I first started, functional medicine was a way into looking. For me, it was a way into looking why people are not healing.
right.
So, taking some courses and talking to people, and talking to people smarter than I was at that time, I start focusing not just on what I was doing from an interventional standpoint to people, but I started focusing on their health. And I developed this concept, or I'm sure I stole it from somewhere. I mean, I'm not claiming originality on this, but we developed these in my practice anyway, these ABCs of medicine, right? Or at least of regenerative medicine. And we can talk about regenerative medicine in a little bit, but the ABCs of what we do are: A stands for anthropomorphic analysis, which is a fancy way of saying body measurements, right? So somebody comes in, we do all these body measurements, which is what people classically think of: X-rays, MRIs, physical examination,
Mhm.
history. So this is what I was doing before, right? So
Right.
all this anthropomorphic analysis. The B's stand for biomarkers, right? So biomarker analysis, because again, in my pursuit of getting people better, I realized that biomarkers are important. So what do I mean by biomarkers? It's basically blood mostly, but sometimes urine and saliva analysis of different biomarkers of health.
Mhm.
And again, there are several categories, subcategories in that. And C stands for cognition, or cognitive health, because obviously pain is an emotional response, and pain is, or chronic pain is, in large part determined by somebody's mental health, right?
Mhm.
And it has a very strong correlation with mental health issues.
Right.
So C again standard for cognitive health. So we started looking at our patients from, using these ABCs of precision medicine or regenerative medicine, and this allowed me to have a completely different take, a completely different view on my patients,
Mhm.
and help them in different ways, of course.
Right. I definitely can uh, understand this kind of concept of looking at the person as a holistic approach, as opposed to a lot of times in a more mainstream medical approach, it is very, very isolated. As you
Yes.
were saying, like you just keep zooming in and zooming in, and then suddenly it's like you're looking for the problem and it's getting narrower and narrower. And the more that you start to kind of ignore the other parts of the body or parts of their health, you actually becomes more and more difficult to understand why they are experiencing this particular problem, or what your path is for actually helping that person to
Absolutely,
recover.
yeah. I mean, the way you train in medicine, in the United States, but basically everywhere in the world these days, is, this over specialization. So more and more about less and less, right?
Mm.
Until you know everything about nothing, right? Well, it's true. So there's this. You have to sort of extract yourself from the mindset and realize that you have to be a little bit of a generalist
Mhm.
without losing your skills as a specialist, and that is really hard to do. It's
Right.
it's really hard to do. And one thing that I realized pretty fast, after getting into, or studying functional medicine, it was just, to me, it was like going back to medical school because,
Right.
even in medical school, they don't really teach you these kinds of things, right? But one thing you realize pretty fast is that you can't do it all on your own, right? So you need a team approach. You need people that think the same way. So I've been pretty fortunate that we've built a team-based approach to my clinic, where we have people doing regenerative medicine and all the stem cells and everything else, and that would be me. And then we have other people doing the functional medicine and the integrative medicine approach and taking care of our patients from a different standpoint. And
Mhm.
those would be my nurse practitioners. We also have a physical therapy, certain types of physical therapy that are geared algorithmically towards our approaches to things, right?
Right.
So yeah, it's hard. It's really, really hard if you're steeped into the classical training to shift, and it's hard. It's a mental shift, but it's also, you also have to navigate if you want to do this under the insurance based approach, right? It's even harder, right?
Mhm.
Because
Mhm.
you have to find a way of being reimbursed for what you do, in a system that's not designed to reimburse what you do, essentially.
Right.
Which is why most people who do functional medicine, integrative medicine, have chosen to practice outside of insurance. The problem with that is that, obviously, practicing outside of insurance basically reduces your audience, so to speak, not
Mhm.
audience, your potential patient, but patient load to very, very few. Not
Right.
very many people are able to spend the kind of money that, the cash based functional medicine, or cash based any medicine for that
Right.
reason, is requiring of them. So again, it's a balancing act, right? You want to treat, you know the UPS driver, right? You want to treat, everybody. You want to
Mm-hmm.
treat everybody who has these problems, not just the people who happen to be, wealthy, right,
Right.
and be able to afford these kinds of treatments. So it really is a balancing act. And I don't know that we found the ultimate formula, but we found a formula that seems to be working, for us in our little
Right.
bailiwick.
Definitely. So, can you maybe point to? Um, so, there's two ways of looking at it: either the things that were uh, preventing people from healing
Mm,
in the mainstream model,
right.
or similarly, the things that really created a healthier environment for people, help them to heal better using the kind of functional approach.
Well, yeah. So there are probably three basic tenets that we look at, and all three of these, or either one of these, usually prevent healing or prevent health. The first one is obviously metabolism, right? So metabolic optimization is one thing that we do the most. So again, what's metabolic optimization? Those are fancy terms of people trying to lose weight, right?
Mhm.
Eat, healthier food, have generally a better body composition, right?
Mhm.
The crux of all this, in my opinion, is the hormone insulin and insulin resistance, right?
Mm.
So most people who have metabolic derangements, you have to start with insulin, and you have to, realize if they're insulin resistance, or their sensitivity to insulin, and so on and so forth. So that is it's a major contributor to, weight gain. It's a major contributor to associated chronic conditions related to visceral fat, including, knee pain, including back
Mhm.
pain,
Mhm.
including the things that were coming to me, right?
Right.
I mean, the people were coming to me because they had bad back pain, right? So in the process of talking to them about back pain, I started saying, well, let's look at your weight, right?
Yeah.
Let's look at your metabolism, your insulin, and all that. So metabolic or metabolism is the first one. The second sort of impediment, to being healthy, I think it's hormones, right? Hormonal optimization, especially in people, in postmenopausal women, or even in men after the age of, say, 45, 50, right? As we get older, our output of sex hormones and other hormones decreases, right? This is a natural process, right? Well, optimizing, hormones leads to increased quality of life, unequivocally.
Mhm.
I mean, it's not even a point of contention. But in my world, I found out that optimizing hormones makes people heal faster, uh, makes people have less pain, gives them stronger joints, stronger tendons. So it basically prevents the types of musculoskeletal and spinal conditions that they come to me to begin with, right?
Wow.
So metabolism and hormones, right? And then third is it's a big field, and it's I don't know how much time we have to talk about this, but it's inflammation, right? So inflammation is obviously it's talked about quite a bit, right? But clearly inflammation and the chronic inflammatory burden,
Mm.
everybody has, is definitely a determinant of health, or an impediment to good health. And it can create anything from chronic pain, right, to cardiovascular disease, even Alzheimer's disease, and cognitive decline, et cetera, et cetera.
Right.
So now in this big category of inflammation. Now, of course, you can talk about a number of things. You can talk about gut health, you can talk about nutrition, you can talk about a lot of things, right? But these are the three things, to answer your question, that we started to look at, in relationship to chronic pain and in relationship to the patients who are coming to me. And everybody wants to lose weight, right? Everybody wants to be healthier. Everybody wants to feel better, right?
Mm-hmm.
Everybody wants to get rid of pain. Well, what did we do before? Well, we just gave people steroids, right? We gave people cortisone injections, and we did ablations, and we did all these. And don't get me wrong, those still work, in a lot of people, but we found that combining those things with this analysis, the ABCs that I talked to you about, and these three categories that I just talked to you about, yields much better outcomes, and more importantly, prevents people from having the same problem again, right? Because we pay a lot of we pay a lot of lip service to preventative medicine, right?
Mm-hmm.
Prevention, but it is absolutely clear to an impartial observer of our society and our healthcare that we're not really doing well in the prevention part, right? So again, as much as we can do in an insurance-based system, we look at all these things.
Right. And truly, the Wellness Plus podcast, our whole goal of being here is to help give people that information they can use
Right.
to improve their life in these different ways.
Right.
So I love each of those different areas you touched on. Obviously, when you were speaking about hormones, one of the big things that I realized is that you mentioned cognitive health as one of the earlier kind of components of people's ability to heal or their likelihood of recovery, so to speak. So in addressing hormones, obviously insulin, a very big one as well, but really getting into the I guess cognitive health or mental health, just having the energy to
Absolutely.
do the healthy things we want to do, to make the healthy meals at home, to make those choices. So much of that does come back to that element of our cognitive health and how we're feeling. So it's kind of interesting how it kind of came from multiple sides, this element that we want to be really caring for how you're feeling.
Right.
And when we start to do that, actually, it has this little domino effect of
Absolutely.
helping you in so many other areas.
Absolutely. I take your point, and I'll even raise you one. There's amazing research coming out in the role of sexual hormones in cognitive decline, right? Or the lack of sexual hormones and correlation with Alzheimer's, right? Estrogen and lack thereof, and development of Alzheimer's in postmenopausal women, testosterone, et cetera. So yeah, we we neglect hormones at our own peril, actually. So, and it's in it from a clinical standpoint, optimizing hormones is one of the most rewarding experiences that you can have as a clinician, right? I mean, I'm a PMNR, pain physician, right? And what am I doing, talking about hormones, right? Well, what I'm doing talking about hormones is the fact that there seems, well, for a longest time we had this stigma, right? Oh, well, you just, why are you trying to optimize? Why don't you just age gracefully, right? Well, that I think there's something to that, but we found that there is a different alternative to aging gracefully, and you can actually have a different quality of life. We're not really looking necessarily to make everybody live to be 120, right? Although that would be nice. But certainly, the quality of life, after, a certain age and after certain hormonal changes, which are obvious in women mostly, but in men too, is, I think it's just paramount to, hormones are paramount to that.
And really, I think it's most interesting that you came to this realization in observing the different patients you're working with.
Right.
In my perspective, I became very interested in functional medicine kind of early on in my interest in medicine and interest in the body. And it was kind of interesting to hear this perspective from someone who actually was really in that mainstream area. And then through looking at the patients, looking at all of these different situations where, as you were saying, one person recovers, another person in a seemingly similar situation has this totally different result. And it really does start to kind of explain why the philosophy of functional medicine has become so prominent and has been embraced by a wide range of different types of physicians.
Right.
And I have this same realization that you had, that when you start to compartmentalize too much, I love what you said, looking more and more at less and less
Yes.
until we see nothing at all or
Yeah.
something.
Until you know everything about nothing.
Until you know everything about nothing.
Yeah.
I love that. What a perfect way of looking at it.
Yeah.
So if we were to maybe start to look in some of those areas, what are things that people could do right now? So I imagine people listening, perhaps they're in a situation where they are experiencing pain. Perhaps they've been told by their doctor that they need to have some kind of surgery on the spine or the peripheral areas, as you mentioned. What are things that people can start doing to start going through those different areas? So you talked about the hormones, the metabolism, the inflammation.
Right.
Any recommendations you have for folks?
Well,
I guess that's kind of a lot. Maybe we have a different podcast for each of
that's
those.
right. That's right. Well, I mean, I think the most, I think what people need to or should take away from the short podcast, without getting, giving a an 8-hour lecture into what they can do, is awareness, right? So if we can do anything, and hope to impart anything from this conversation to our audience, is the awareness of the fact that there are alternatives, right? So what do I mean by that? Well, let's take, for instance, you mentioned surgeries. So let's go back a little bit to my bread and butter, right? Like spine condition, back pain, right? Let's take back pain. So, most of the time, a person with back pain or chronic back pain will be completely confused about their condition, right? Why is that? Because they will have seen a number of specialists, a number of doctors. They will have had a number of procedures on their spine, some of them more or less successful, but always temporary, right? Most people who come to me with back pain do not have an understanding of why they're hurting or what their diagnosis is and what their sources of pain are, right? So what can people do about it? Well, seek education from their practitioner, right? So when they go and see a physician, they should ask questions and seek the practitioners that spend some time educating them, right? So the regenerative medicine part, which was my first step into thinking different, right? to paraphrase the 1980s Apple commercial, right? So my first step in that was regenerative medicine. So I realized that the body has the potential to heal, right? Obviously, right? And when we don't heal, that's because something in our body is not working properly, right, anymore. So, or because we're too injured, or we're too old, or for whatever reason, right? We're not optimized. Our health is not optimized. So regenerative medicine, is an alternative to, sometimes, not all the time, right? Not for everybody, but sometimes regenerative medicine is an alternative to big time surgeries, right? So what is regenerative medicine? Well, regenerative medicine is a branch of medicine that helps your body heal from within, right? So it uses biologic agents, whether they're from your blood or from your bone marrow or from your fat tissue or whatever. It uses biologic agents, so introduces biologic agents in the areas of injury, hoping that these, your own biologic agents, will help your body heal, right? So the awareness that there are other options besides surgery, or besides, a bunch of epidural injections or a bunch of cortisone injections, is the number one thing that people can have in terms of regenerative medicine, right? Now, in terms of going beyond regenerative medicine, what can people do to be healthier, right? In general,
Mhm.
and that obviously translates to a chronic pain condition, right? Is to find a practitioner, find a physician or a practitioner who talks to them about what we just talked about,
Mhm.
talks to them about their metabolism, talks to them about hormones, talks to them about inflammation. Unfortunately, this is hard to do in a primary care model of
Right.
care, insurance primary care model of care. And that's not because the doctors do not care about it, or they wouldn't like to do it. It's just simply it's unsustainable from a material standpoint
Right.
for your primary care physician to sit there for half an hour, 45 minutes, and educate you towards all these things, right? So what's the take home point for your audience? Well, try to find a practitioner who knows about these things and is able to have a conversation with you about all these things, right?
Mhm.
If it's not your primary care doctor, there are now, luckily, for all of us, enough practitioners, even in the Austin area, but in the United States in general, there are enough practitioners who are thinking, let's say, out of the box,
Mhm.
right? So the awareness that surgery is not inevitable, and there is a regenerative part of medicine now that might help, not everybody again, but might
Mhm.
help. And also the awareness that healing is based on the health of your whole body, and finding a practitioner that helps you with that will be the first step. Now, of course, there are certain rules, and I'm sure that anybody listening to this or watching this knows them already. I don't think they need me to tell them that they need to, eat healthy and
Mm.
move and exercise and all that. I mean, that those are the basics of health, that everybody should follow. Unfortunately, the through COVID now, and then generally the lifestyle that we have is not conducive to that. But yes,
Mhm. Mhm.
you should eat healthy food. You should eat whole foods. You should eat vegetables. You should refrain from eating, carbohydrates or refined carbohydrates,
Mhm.
especially after a conversation with your physician about insulin resistance or your
Right.
insulin sensitivity. You should find the diet that's appropriate for you. You should go and walk, if nothing
Mhm.
else, right? So those are just, basic things. But, being aware that there are alternatives is probably the most important thing. Do
Mhm.
not just be happy with the status quo, right? If the
Right.
status quo doesn't work for you, just seek something out, because you will find somebody who can talk to you about that.
Right. And I think also this component that we recognize that we're not in a situation of helplessness. In so many situations, I see, so through my health coaching, where a lot of times I'm
Mm,
working with people trying to help them figure out how they implement those different health recommendations in their lifestyle.
right,
And a lot of times people are feeling very disempowered.
right,
Like, oh, well, I need to do this, but the doctor kind of didn't really make it sound like it would make a big difference.
right,
Or maybe they don't realize how much control they have over their situation. So there's kind of this element of just empowering people to realize that they have a great deal of control of their situation.
right.
And I hear sometimes people say things like, oh, I just have a bad back. I just have a
Hmm.
bad back.
Right.
And I'm thinking, man, well, either there are a lot of people in the world that just
Yes.
have a bad back,
Yes.
or maybe this is kind of a strange, I don't know, kind of way to get a glimpse into our own psyche,
Right.
which is that we just accept our problem, accept our situation, accept that there's nothing we can do about it,
Right.
and then kind of, okay, well, what do I do from here? Okay, it's managing the pain,
Hmm.
it's managing the symptoms to the point that I can still get through my life or get through my day. So this element of empowering people to know that there is a solution for them, and that
Right.
there's a lot that they can do to change their situation and not feel that there's just something wrong with them that can't be fixed.
I think health coaching has done a tremendous job, in helping people with that. And I think there was a definite need a gap, right, between your 4-minute appointment with your doctor,
Mm,
and then being at home by yourself and not knowing what you do, this
right.
helplessness state that you're. And I think health coaching is amazing. If now health coaching also has to be tailored to the individual,
Right.
and it's all fine. And again, getting back to what we talked about in terms of functional medicine, metabolism, inflammation, hormones, right? You can tell people all you want, hey, do this, do that, right? I mean, it's if it's a metabolic condition, untreated metabolic condition that they have, right? They're just simply not going to get there, right?
Hmm.
So it has to be this team-based approach is very important, right? I mean, you have to talk to your functional medicine or whatever your physician, your practitioner. You have to understand what's chemically imbalanced in your body and try to balance that out. And of
Hmm.
course, on top of that, you have to have the behavior changes and the empowerment and all that stuff, right?
Right.
I think the most successful clinics who do this and most successful practitioners who do this, have a combination of both. So
Right.
there's the medical knowledge, and there's the the physical therapy, maybe the exercise part, and then the health coaching and all this stuff. Again, it's not always easy to have everything in one place. I mean, we
Right.
try to do. We don't have health coaching, at this point. I mean, we try to do it ourselves, but I definitely understand the value of having something like that. Again, an insurance based model doesn't, as far as I know, maybe it's changed, but as far as I know, insurance based models do not pay for health coaching. And that's, again, you're also walking this tightrope, and asking
Hmm.
people to pay for things, right?
Right.
Right. I mean, it's a problem, right? Not everybody will just immediately spend a whole lot of money on a program. There
Hmm.
are lots of people out there who have all sorts of programs that are more or less expensive, and I think that's great.
Hmm.
Okay, our job in my practice is to take people who would go to a physician, just anybody who goes to the doctor, right? And teach them, what they need to do in order to be successful, in
Right.
their goals. I
Hmm.
mean, it's just simple as that. We limited by the insurance model? Yes, we are. And some of the stuff that we do is outside of the insurance model because it has to be, right?
Hmm.
But yeah, it's a fine line. It's a balance line. But to your point, health coaching and empowering people, out of the state of helplessness is actually it's paramount to their getting better.
Hmm.
Absolutely, I
Hmm.
agree.
And it's an interesting situation that we are put in, that you um, essentially can spend as your uh, a time, your attention, your efforts in one area, or you can kind of take the what I consider the easy route, which is the maintenance through pain pills, kind
Mm,
of maintenance in the mainstream area, which could be argued that financially is not as um,
expensive.
expensive, demanding. I was going to say
Yeah,
financially demanding, but
yeah,
in one way, we can look at this and say, oh, well, okay, well, if the insurance is taking care of it, I'm just going to go this
yeah.
route. But as you mentioned earlier, what is our actual quality of life?
Right.
Where does our actual, way that we're feeling each day that we wake up? And sometimes it is kind of changing our own inner dialogue, that maybe realizing that what is maybe the more expensive route is
Mm.
actually worth that, because we're going to feel so much better in that
And it might be cheap.
path.
It might be cheaper in the long run, right? If you
Yes.
consider what you're avoiding by
Hmm.
doing those things. I think you had very important point there, which is the mindset, right?
Mhm.
The mind frame of insurance,
Right.
right? Well, doc, if insurance pays for it, I'll do it, right? If insurance doesn't pay for it, I won't do it, right? And it takes a long conversation, right? And it takes a lot of education on my part, right? When I talk to patients, on explaining to them and making them understand that the reason I propose certain things that are not paid by insurance is because I really think that might be better for them
Right.
than the things that are actually paid for by insurance.
Right.
I don't think any of us really understand why insurance pays for certain things and doesn't pay for other things. And it's not my intention here to get into a conversation about the how these things get approval, insurance approval, right?
Mhm. How do they choose?
How do they
How do they
choose?
choose which of our medical
You
procedures
know,
are worth their
right. I mean, it should be based on science. It should be based on clear, scientifically rigorous parameters, right? But is it always, right? I mean, we are, for better or worse, in a society where there's influence, there's lobbying, there's money everywhere, and
Mhm.
again, most of the stuff insurance pays for, they do because there is a scientific reason for it. Now, we can argue at this point that there may be enough science that maybe some of those regenerative treatments should be covered. I understand why they're not covered. The insurance companies are not in the business of
Patient
cover.
outcomes?
Yes. They're in the
I mean,
business, they're in the profit. It's a profit, market, and profit drives our society, and profit is not necessarily a bad thing. I'm not here to deny that profit is a main driver of capitalism, and we all for lack of a better term, profit from it, right?
Mhm.
However, to your point, when people come in and say, well, I will do whatever insurance pays for, I find it as a personal challenge to explain why I'm proposing what I'm proposing, right? And build that rapport and the trust with every patient that I see,
Right.
and in order for them to understand that I'm looking out for their own benefit, right?
Right.
Part of that is keeping whatever we charge as cash, we keep prices down, right? We're not trying to be the most expensive people in the world. Again, it's a long process. It really
Right.
is a long process. I think most people come to us now because they've heard what we do, and they say, well, doc, I'm ready for my stem cells, or I'm ready for this, I'm ready for that, I'm going to do it all, right?
Mhm.
And those are easy, right? Because people come in, they're already they know what they're doing.
Right.
They're already sold on our approach, so it's easy. It's the challenge is the patient who comes in from just oh, I was referred to you by my primary care doctor, I was referred to you by my spine surgeon, or whatever.
Mm.
And educate. It's incumbent upon me and upon our team to educate people about what we do. I mean, that's
Right.
just as simple as that. I
Right.
mean, if you believe in it and you're enthusiastic about it and you show good outcomes, essentially, that's what's going to drive, more people to come to you. We don't advertise. We don't, I mean, it's a referral based,
Mm.
practice, and people refer other people when they have good results themselves. And I think that keeps everybody honest too,
Right.
right? It's not, you know, our face out there, on Super Bowl ads or anything like that. We wouldn't be able to afford that.
I just can imagine what a great Super Bowl ad that
Oh
would
yeah,
be, though.
exactly.
I might actually watch the Super Bowl.
Optimize your metabolism. Yeah,
Well, I just want to thank you so much for coming on the program. And I
absolutely.
think that we have so many different areas that we've just kind of touched on here today that we can start delving a little bit more detail in our future interviews.
I'd be glad to.
Definitely. Thank you so much for coming on the program today. And I look forward to having you back again
No
soon.
problem. Thank you.
Definitely. Thank you so much.
Right.
Thank you so much for joining us for today's program. Hope you'll subscribe, and I will look forward to seeing you next time.
Welcome to Yoga Plus. Courses available from pupil to yogi. Sort by yoga, fitness, and instructors. Create your own routines. Access the Pose Library. Yoga Plus by Psyche Truth. Available on Google Play and the App Store.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psyche Truth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.